If you're a runner and you've recently had meniscus surgery, you may be wondering, is it safe to return back to running? It's a phenomenal question and a question I get all the time. So in this video, I wanted to walk you through the exact parameters you need to think about to know that you are safe for returning to run so you don't re-tear your meniscus or worse, develop arthritis in your knee. Hey everyone, I'm Dr. Kevin Vandy, physical therapist and running specialist. And in this video, I'm going to tell you exactly what the research shows about who is at risk for re-injuring their knee after meniscus surgery and who is okay to begin a return to run progression. So before diving into the specifics of what you need to look for, let me just say a resounding yes. Yes, you can return to run safely after having meniscus surgery. For at least 80% of runners out there, that is the truth. It may take you slightly longer than you expect, and that might not be the 2 weeks your doctors promised. It's probably going to be more to do it safely between 8 and 12 weeks because you have to rebuild your muscles, you have to get them active, you have to rebuild the alignment, you have to fix the cause of what caused the meniscus issue in the first place, and you have to recondition your cartilage to the demands of running. All of that takes approximately 8 to 12 weeks. I know that sounds like a lot of time, but in my experience doing this for 15 plus years, that has yielded the safest return to run. But there are some other factors you need to consider regarding the safety for returning to running, because the things that may get in the way that could derail your running career is a re-tear of the meniscus or developing osteoarthritis, arthritis of the knee. That's the last thing you want by going back to running too fast. So what do you need to look out for? Here are the specifics. The specifics I'm about to walk you through have been studied in research, and when you have a combination of these factors, the more you have, the higher risk you have of developing arthritis and re-injuring your meniscus. The first parameter is how much of the meniscus was removed from your surgery. Your meniscus, again, is this inner layer between the two bones of your knee. It's a shock absorber. Most of the time these days, they try to remove as little as possible of the meniscus to preserve the shock absorption and protection of your knee. If you have more than 1/3 of your meniscus taken out, that increases your risk of developing arthritis and having additional injuries at the knee. So greater than 1/3 meniscus removed increases the injury risk. The next risk factor you want to think about is age. Research has shown that if you're over the age of 40, that also increases your risk of having injury. Now, these, again, need to be combined. So being over 40 by itself does not mean you're going to have an increased injury risk, just like having more than 1/3 of your meniscus taken out by itself doesn't increase your injury risk. But combined, as we go through these other factors, the combination of all of them can increase. So age is a factor. When you're younger, your cartilage is healthy and it can rebound from injury. Again, it doesn't repair, but it's just healthier to withstand the time off from running and the reintegration back into running. And it's also has some vascularization in the underparts of the bone that help with the recovery. The next factor to think about is, did you have pre-existing osteoarthritis of the knee? Oftentimes, you're going to have an MRI or X-ray before you have a meniscus surgery. Even in the surgery, they'll take pictures so they can see the health of the cartilage. If you have grade 1, grade 2, grade 3, or grade 4, meaning some evidence of arthritis in and at the knee joint, on your femur or on your tibia, then that also increases your risk of developing or progressing the arthritic changes of the knee. The pre-existing condition lets you know that there's some wear and tear that's happened on your knee that needs to be changed in recovery with a therapist or running specialist to help you to reduce that load and at least maintain what you got without progressing it further. The next factor to consider is, how did your meniscus happen? There's traumatic tears, which happened because of injury. You fell, you twisted your knee, you got hit in a sports game. Those are all sites of trauma. The other way that you can injure meniscus is degenerative. It just gave out, wear and tear. You put too much workload through it and you developed a tear in the meniscus. In terms of injury risk, when it's on the degenerative side of things, meaning you don't really know why it happened, that does increase the risk factors of future injury because there's a biomechanical, a movement error that is taking place that is straining the meniscus and straining the knee joint. Even more reason to see a physiotherapist specialist or expert to be able to correct those strength deficits, range of motion deficits, or alignment deficits. The next factor to consider is, are you male or female? In general, via the research, females who undergo meniscus surgery tend to have more arthritic changes after the surgery than males, and it increases the risk factor for develop that after surgery. Again, it's not something we can change, but it is something to keep in mind that it's been shown that females do have a greater risk factor after running. Again, it doesn't mean you can't run, especially if you don't have any of the other factors. It just means it's something to consider. The next key factor is BMI, or body mass index. You can find many free body mass index charts online. They look at your height and weight, and they give you a body mass index number. If you're greater than 30, that increases the pressure on your knee cartilage, and that drives up the risk of developing arthritis or re-injuring your meniscus. So you want to have your body optimized so to be under 30 BMI to reduce your risk of injury after meniscus surgery. The next factor to consider is, did you have your medial inside part of your knee or lateral outside part of your knee meniscus worked on? If it was the lateral side of your knee, that does increase the risk of injury versus the medial side of the knee, which has less of an injury risk. So you just want to ask your doctor, get the surgery report to figure out which side of your knee you had the meniscus injury on. If it is the lateral side of the meniscus, you want to make sure you rehab well and a bit slower to get back to running so you don't overstrain your knee joint. The final risk factor is alignment. So alignment of the knees your knees can either be bowed out or bowed in. They can be straight as well, but often they're one of the other. And either cases, whether your knees are bowed out or bowed in, both need to be taken into account because they can strain when your knees are bowed out, it is going to strain the medial part of your meniscus, and when it's bowed in, it's going to strain the lateral part of your meniscus. So those are risk factors to consider. So with this list, the more you checked off as having that risk factor, the slower you have to progress to running, the more emphasis you have to put on physical therapy, strengthening, alignment training, changing your running biomechanics, improving your cadence and vertical oscillation, all those things that make for healthy biomechanics. You want to focus on those and at least spend 8 weeks in rehab, preferably 12, to work with a specialist to make sure you get that done correctly. Again, even if you have all the risk factors, it doesn't mean you shouldn't run. It just means you should progress with caution. It just means your risk is higher. Some people in those categories might be able to run no problem. Some people may develop further injury. This list has been studied over thousands of runners. It is a great starting point. Share this with your physical therapist, share this with your medical team, and design a plan to get you back safely and done well. Some other factors to consider: run every other day. When you do start a running progression, you want to do a walk to run progression. You don't just want to hit the 8 weeks and go for a run. That is going to overload your cartilage and really drive up your risk of inflammation and wear and tear on your cartilage. You want to walk for instance, 5 minutes, run for 1, and then gradually change that ratio over a period of months to reload the cartilage in a healthy way. If you want more information, you want to go deeper, you want an exact plan to follow to return to running after having meniscus surgery, there's a link below, description to my course, the Run Safe, Run Strong program. That may suit you to be able to have more information of how we at my clinic transition runners back to running safely, even if you have some of these risk factors. All right, so this hopefully provided some education, some clarity about what to look for as you come out of meniscus surgery. Again, 80 to 90% of runners can return safely to running. You don't have to give it up. You don't have to cycle. You don't have to swim. You can continue to run just with the right plan, the right rehab coach, the right rehab specialist. Be sure to tell your doctor this is possible if done right. All right, guys, like, subscribe, hit the notification bell, and until next time, train smarter and perform better.